The safety and success of any surgery at all, especially elective surgeries like liposuction and BBL or any cosmetic surgery at all, or even the more complicated weight loss surgery, will depend on the skill, the expertise, and the experience of the surgeon. But beyond that, it would also depend on having pre-operative laboratory investigations in place with the parameters within normal range. And in this video, I'm going to be taking us through 9 important laboratory investigations that you would need to do before going in for any elective surgery at all, be it a weight loss surgery, a cosmetic surgery, an appendectomy, a myomectomy, a cesarean section, or even a knee replacement surgery, any surgery at all. So the first is the full blood count. In your full blood count, there are a few parameters we want to consider: your hemoglobin concentration, your packed cell volume, your white blood cells and differentials, and your platelet concentrate. Your hemoglobin is what the blood uses to carry oxygen and delivers it to every tissue, every cell of the body. And your packed cell volume, your PCV, tells us if you have enough blood in you before we can consider taking you in for an elective surgery. It is the packed cell volume that would usually assess to know if a patient will need to be transfused or not. Your white blood cell and its differentials will give us an idea if there is an ongoing infection that needs to be treated before surgery, or even your immune status, because you need an optimal immunity to be able to withstand infection during surgery and even after surgery. On the other hand, platelet counts help us to assess your blood clotting ability and the risk of bleeding. Number 2 test is blood group and genotype. For every elective major surgery, there is usually the risk of bleeding beyond the limits of safety. We would want to get a potential donor for you whose blood group is compatible with yours, a donor that can donate to you. So we need to know your blood group. It helps us to know the blood group of the potential donor. We bleed them, put their blood on ground, so that if you need to be transfused during surgery or in the immediate post-operative period or even in the recovery period while you're on admission, we'll be able to transfuse you without running scatter. Their blood is on ground. Why do we do genotype? For major surgeries like cosmetic surgery, somebody who has hemoglobin SS, those we call C class, would usually not want to go in to do a major cosmetic surgery for them, in line with liposuction and BBL. So if you are AA, if you are AS, you qualify for surgery. But for hemoglobin SS, we usually want to tread with caution and see very, very well if they qualify for liposuction and BBL for any form of cosmetic surgery at all before going ahead with them. When we know that they are C class, we'll be able to take extra precautionary measures for their safety and the success of the surgery. The third test we want to do is your clotting profile. There are a few parameters in the clotting profile. We have what we call the prothrombin time, we have what we call the activated partial thromboplastin time, and we have what we call the INR, the international normalized ratio. Don't worry about all of those jargons. We use the clotting profile to assess in details the clotting ability of your blood. Surgery comes to create some form of trauma through the incision. We don't want you to bleed beyond the limit of safety. That's why we do your clotting profile. The fourth test that would usually include is your blood chemistry, by which I mean your electrolyte, urea and creatinine, your kidney function test, and your liver function test. This would help us to assess your metabolic status, your kidney function status, and your liver function status. How healthy are these internal organs, your kidney and your liver? Now, the liver will help to metabolize all of the medications that will be used intra-op, antibiotics, anesthetic drugs. The liver will help to metabolize them, and the kidneys would help to excrete them from your system. That is why we need to know the status of your kidney and your liver. For your electrolyte, your potassium, for example, potassium is used for muscle function. It has a lot to do with the muscular activity of the heart. We need to be sure that every parameter in your electrolyte is within normal range, so that safety is sure and life is not compromised during surgery and in the immediate post-operative period. Number 5 is your blood glucose level. This is very important in those that are diabetic or those who are at risk of developing diabetics, because an high blood glucose would put a patient at risk of infection and poor wound healing. And a low blood glucose also has its own complications intra-op and in the immediate post-operative period. So after running your blood glucose test, if it is very high, we would make sure that it comes down to within normal limits within the body, normal limits of safety for good wound healing and to reduce the risk of infection. That is why we request to do your blood glucose test. Number 6, for women of reproductive age group, we request for a pregnancy test. When pregnancy test comes out and is negative, surgery date is already scheduled, they go in for their cosmetic surgery or for their weight loss surgery. For those whose pregnancy test comes out to be positive, surgery and or anesthesia can prove to be very risky to the mother and the developing fetus. And what we consider utmost is about safety, then success of the surgery. So for those who are positive, we defer or we postpone their surgery until the end of pregnancy and or breastfeeding. We want mother and child to be safe and to be alive and well at the end of conception. So usually, if your pregnancy test is positive, we would postpone your surgery. We don't want any risk from surgery or anesthesia to you. What we want is safety, 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 success, and good outcome from your cosmetic surgery. The 7th test we want to do for everybody is a serological test, what we call viral serology. What do I mean by this? They include HIV, hepatitis B, hepatitis C. And we do this test because of patient safety to also reduce the risk of superimposition of infection from bacterial sources during surgery or after surgery, and to also encourage proper wound healing. Again, this is necessary for safety on the part of your healthcare provider and the entire clinical team. Number 8 investigation is urinalysis. Why do we need to do urinalysis before an elective surgery of this sort? It helps us to know if there is an ongoing urinary tract infection, that is one. It helps us to also further assess the status of your kidney function, that is two. Remember, we mentioned that kidney function is very, very important because the kidneys are the organs that we use to excrete metabolized drugs and toxins from the body. Number 3, it would also help to assess our metabolic status or the metabolic status of the patient. In line with that, earlier on we mentioned those who are diabetic. So urinalysis could also be a pointer to the severity of diabetics in a potential patient for cosmetic surgery. So we do urinalysis to be able to look at all of these parameters to be sure if this intended patient for cosmetic surgery or for a weight loss surgery is actually fit at that point in time to go in for his or her surgery. Again, let me reiterate, we have to consider the safety of the patient even before talking about the skill or the expertise of the surgeon that brings about good outcome and success of surgery. The 9th group of investigation is usually not routinely done for everybody. It is usually reserved for a specific group of intending patients for cosmetic surgery or weight loss surgery. How do I mean? Let's take, for example, we have patients with long-standing hypertension, diabetics, or who are morbidly obese. Now, this group of illnesses increases the risk of people coming down with heart diseases. In line with this, we would ask these patients to go ahead to do an ECG plus or minus an echocardiogram. And in very extreme cases, we could even ask them to do a chest X-ray. All of this must be in place. The results or the report of these investigations must be in keeping with safety before we consider them fit for surgery. That is on one hand. On the other hand, let's take another example. Somebody is HIV positive, for example, and we talked about proper wound healing, we talked about patient safety, we talked about preventive measures on the part of the healthcare providers. We would want such a patient to go ahead with a viral load and with a CD4. These are parameters around HIV infection. These are all parameters that gives us an holistic idea in the extended form about what the safety of intending patients for cosmetic surgery would be. Because, like I've said over and over again, for the sake of emphasis again, safety is key. It is safety before the skill, before the expertise, before the experience of the surgeon, before going to theater, before we talk of success and good outcome.